When cutting out skin cancer, the question becomes, how much is enough and how much is too much? There is a surgical answer to these questions, and it's one that increases survival rates. Dr. Abel Torres is here to explain. Dr. Torres is the Chief of Dermatology at MetroHealth. Welcome to the show.
Thank you.
We're going to talk a little bit more in depth about one of the procedures, but there's one way that I guess is kind of the traditional or standard way of doing that. So tell us first about that one.
Sure. So the traditional way basically is that you cut out the skin cancer, and in doing so, you're sacrificing some normal skin around it. The question is, how much do you sacrifice? If you take too much, you leave too large of a wound. If you don't take enough, you leave tumor behind. The other problem is that it usually takes about a week to 2 to look at the tissue, and then you get a report back, and so the patient may have to make another trip back for more surgery.
Oh, I'm sure they don't want to do that. So what's different then with this other procedure?
Well, we have a procedure called Mohs surgery, named after the man who developed it, and now it's actually become an acronym where it's known as microscopically oriented histologic surgery. The idea is that you cut it out, and it's an outpatient setting. You do it under local anesthesia, so you don't have to be in the hospital. And you check it under the microscope the same day. That way, you don't take out more than you have to, and the patient doesn't have to make a return trip to find out whether everything was completely cut out.
Sounds better. So why wasn't that done previously?
So in the traditional way of cutting out skin cancer, you do what are called vertical sections. And so the tissue is cut out and cut out like a bread loaf. And so you take the slices, you pull out one of those slices vertically and you look at it, but as you can notice, you're not looking at the entire edge and you're not looking at the entire bottom. In the new technique, what happens is it's cut horizontally, so you cut through the entire bottom. So think of it like a salami, and if you cut through it, you see the entire bottom, plus you see the entire edge. So it gives you a much more accurate way of looking at the margins.
Oh, that sounds like a much better way to do it. So that better way of looking at the tissue leads to better survival rates?
Correct. So it's not so much survival rates as cure rates. And so what ends up happening is because you're looking at least 80 times more of the tissue or so, the end result is that your cure rates are higher. So the traditional technique, it would be somewhere between 70 to 90%, depending on how big a piece of extra skin you sacrifice. With this technique, you can get cure rates anywhere from 98 to 99% without sacrificing extra tissue.
Okay. Now, when we're talking about extra tissue, how big is that we're talking about?
It depends on the tumor. If the tumor is very large, it could mean something that could be several inches. If its tumor is very small, it may just be a few millimeters. And then it's relative. If it's right next to your eye, a few millimeters means a lot. While if it's on your chest or your arms, a few millimeters doesn't mean that much.
Yeah, that's true. So can you use this for all types of skin cancers?
So you use it for the majority of skin cancers. The best ones are squamous cells and basal cells because they tend to grow as one piece that are contiguous. For melanomas, it's less often used because that doesn't always grow together, and therefore you have to use certain other techniques. But it's used for basically basal cells and squamous cells.
Okay, it sounds like it's a great technique.
It's a very good technique. It took a while to develop simply because they had to be able to freeze the tissue hard enough to be able to look at the tissue and stain it. And now that we have better stains, we have better freezing, and now we have even what we call immune stains so that you can use it for special types of tumors, there's a lot more versatility to it. The other part was just people learning and being trained in it. And now that a lot of people have been trained about it, pretty much every major academic medical center or hospitals has somebody who can do this type of technique.
It's great. When it comes to removing skin cancer, along with healthy tissue, you don't want to take too much and you don't want to take too little. With Mohs surgery, the amount you can take will be just right. My thanks to Dr. Torres for sharing this important information about a type of surgery that's a cut above.
To learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org.